Hi everyone, my name is Tanisha Basu, and I'm a nutrition, health, and wellness major here at Texas Tech University. For my final project for my class, I was assigned the supplement beta alanine, and the following presentation is a critical analysis of the benefits or side effects of beta alanine as an ergogenic aid. This is an image of a beta alanine supplement container. And according to bodybuilding.com, the cost per serving of beta alanine is 36 cents on an average. The image below is of the chemical structure of beta alanine. So, the claim to fame of beta alanine is that it's widely popular among strength and endurance athletes. Several studies claim that beta alanine causes an increase in the markers of aerobic respiration during endurance performance, body composition, and strength. It claims to do so by reducing muscle fatigue. This is a picture of an endurance athlete. So, an athlete who participates in an event like a 400-meter dash would be considered an endurance athlete. So, let's look at some scientific research on beta alanine. So, beta alanine supplementation augments intramuscular carnosine content, leading to an increase in muscle buffer capacity, a delay in the onset of muscular fatigue, and a facilitated recovery during repeated bouts of high intensity exercise. To explain that sentence better, I have this flow chart. So, during high intensity exercise, um, our body, our muscles use anaerobic respiration, which in turn produces lactic acid and hydrogen ions. The hydrogen ions decrease the pH levels and then in turn decreases performance. So, what carnosine does in our body is that it buffers the hydrogen ions and stabilizes the pH of our bodies, thus decreasing uh, muscle fatigue and increasing performance. So, where does beta alanine come in? Basically, what beta alanine is one of the two compounds that are used to form carnosine within our bodies. Studies have shown that direct ingestion of carnosine just results in the breaking down of carnosine into beta alanine and histidine, and therefore not increasing muscular carnosine. However, ingestion of beta alanine, which is the limiting factor in the formation of carnosine in our bodies, the levels of carnosine in our muscles rise, in turn, delaying the onset of muscular fatigue. Studies have also shown that beta alanine supplementation appears to be most effective, as stated earlier, for exercise tasks that rely heavily on ATP synthesis from anaerobic glycolysis. So, that is again important to note that if we would be dealing with athletes that are like marathon runners who do not rely on anaerobic respiration, then beta alanine supplementation would not be useful. However, in repeated bouts of high intensity exercises like the 400-meter dash, beta alanine may have uh, performance benefits. So, some additional scientific research on beta alanine states that body of scientific data available concerning highly trained athletes performing single competition like exercise tasks indicates that this type of population receives modest but potential worthwhile performance benefits from beta alanine supplementation. Beta alanine supplementation has also been shown to increase resistance training performance and training volume in team sport athletes, which may allow for greater overload and superior adaptations compared with training alone. So, in team sports like soccer or football, or resistance training performance like weightlifting, athletes have benefited from beta alanine as opposed to training alone. An improvement in exercise capacity may also be of interest to the population of trained athletes because this population regularly undertakes training sets that are implemented to maximally stress exercise capacity. If performed in the exercise capacity training sense, can be repeatedly enhanced during training, effectively enabling athletes to train harder. The increased training dose may lead to enhanced training adaptations and therefore performance. So, again, what this statement means is that beta alanine may indirectly enhance performance by enabling athletes to train harder and for longer. So, although beta alanine supplementation is relatively new and uh, is a potentially useful ergogenic aid. However, one of the limitations in the existing literature is the inconsistencies in the dosing regimens. So, some say uh, 3 grams per day, while others say 4 to 6 grams per day. So, in relation to the side effects, the dosage plays an important role because high doses of beta alanine have been responsible for unpleasant symptoms of paresthesia, which is basically tingling on the surface of the skin that may last up to an hour. This sensation can be eliminated if the maximum single dose is limited to 10 milligram per kilogram of body weight, which corresponds to roughly an average of 800 milligrams of beta alanine in a single dose. So, is beta alanine safe to use? Beta alanine has been found to possibly interact with some heart medications and with drugs for erectile dysfunction, and its safety has not been established for children and people with particular diseases or conditions, or for women who are pregnant or breastfeeding. Beta alanine, however, is not part of the World Anti Doping Code International Standard Prohibited List as of January 2019. That means that the substance is not on the list of banned substances for athletes and can be used. In conclusion, as a student of nutrition, I would recommend beta alanine to endurance, strength, and resistant athletes. However, I will warn them that the single safe dose has to be limited to 10 milligrams per kilogram of body weight, and I would refer them to a physician to make sure that none of the medication that they might be taking or any of the pre existing conditions they might have interact with beta alanine consumption. And I would not recommend beta alanine to children, pregnant women, and patients with cardiovascular diseases. I come to an end of the presentation, and these are my reference slides. Thank you.